Hello, everyone. It's Dr. Manjiri Nadkarni, Ayurvedic MD, registered holistic nutritionist, back today with another interesting Wellness Wednesday. So, this month we are uncovering a lot of different topics related to digestion. Something I'm going to talk about today is one symptom or one complaint that we see a lot in uh, people nowadays, because of the poor diet, poor lifestyle, a lot of stressors that we are exposed to. I'm seeing this either acid reflux, heartburn, GERD. So we're going to discuss this complex and what exactly it is, what are the differences between it. So if you are watching this live, please say a quick hi. If you are watching this as a replay, please put a hashtag as replay. If you have any questions for me at any point of time, you can post it in the comment section and I'll be more than happy to answer. Hi, Madhu. Hi, Jayesh. Hi, Jessica. How are you doing? So, interesting topic, right? So, do you suffer from heartburn? Is the one thing I have to ask you all because when we talk about Ayurveda and doshas, I'm going to talk a little bit about it as well. So, one common thing that I have also seen is if you have a dominance of this fiery energy called Pitta dosh, then you are more prone to acid reflux or indigestion can cause it, or this heartburn, like this nagging heartburn that doesn't go away. So people who are more pitta type or even a secondary pitta type can experience this. So let's talk about it. I'm going to say a quick hi to Susan as well, and let's get started. I'm just going to open up my notes. It's easier for me to stay on track with my notes, right? So what exactly is GERD? What exactly is heartburn? So heartburn is when you feel a burning sensation in your heart, right? So that's the terminology. Anytime you feel like a burning sensation in your heart, that is understood as heartburn. Acid reflux is any stomach acid that's coming back to your esophagus. So your stomach has acid in it, your stomach naturally produces acid in a bit to help get rid of any bacteria that could enter your GIT, right? So when you're eating food, if there is any bacteria or anything that you don't want in your food, the stomach acid is going to neutralize it. Also, for protein converting enzymes to be able to digest protein, right, pepsinogen has to be converted into protein, and that process takes place because of the stomach acid or HCl or hydrochloric acid in your stomach, right? So if you are for some reason secreting too much of this acid or not secreting enough of this acid, that can lead to problems, right? So one thing is your bacterial count can go high in the body. Then you might have symptoms where you're just feeling tired, you're feeling lethargic, you feel like you're going about the day, but you just don't feel your best. You can be prone to infections constantly because your immune system is trying to fight off these excess bacteria, right? And the other thing that can happen with not a good functioning stomach acid is also that if you're not converting these enzymes, that are required to digest protein, you could be eating tons of protein, but you're not having enough muscle mass. And this is something I see a lot in my clients. When I do a body composition test, I am always amazed as to how much protein people are eating and why they are not picking up that protein in the body, right? And most times it happens because of a poor digestion, a poor stomach acid, right? So let's talk about this. And in Ayurveda we consider this in amla pitta are the conditions, where there's a lot of acidity or the sourness of this pitta condition. Pitta dosha increases in the digestive tract, and that can create a lot of issues. So that's what we're going to talk about as well. Hi Chanchalji, hi Uttamji, nice to see you. So, what are some signs, right? And what exactly happens with GERD? So, GERD is gastroesophageal reflux disease. If you're eating too much food, right, that stretches your stomach and you're feeling over full, some stretching can put a lot of pressure on the lower esophageal sphincter, which then opens up, right? And then the excess acid can also move in the wrong direction, and that from your food can create a lot of heartburn, right? Now, Sometimes people don't eat too much food, but they have a weakening of this lower esophageal sphincter. So there are two sphincters in the esophagus, one is upper and one is lower, and these sphincters have to be shut because the food shouldn't be regurgitating, right? But if you're overeating, if you're stretching your stomach beyond capacity, if you're eating the wrong things, that are creating a lot of bloating or irritation, even certain conditions like SIBO, small intestinal bacterial obstruction, has one of the signs as heartburn. Typically, one of the physiological changes where heartburn can be created is pregnancy. Like if you look at women who are pregnant, especially, because of the distension, like the entire abdominal cavity, when the fetus grows, everything is pushed up, and that could be when the acid reflux is more common, right? So these are some conditions that can, be linked. So what exactly are some symptoms that you're having this, GERD or gastroesophageal disease? One thing is you have a lot of burning sensation in your chest region, usually after eating, and sometimes it's even worse at night because we are all fairly inactive at night, so that's why it's worse at night. It could also experience as chest pain. It could also be presented as difficulty in swallowing. You can also experience a lot of regurgitation of food or sour liquid. You have this sour taste in your mouth, you just feel off, you have this food taste in the mouth after eating, or you have a lump like sensation in your throat, right? Now sometimes people don't exactly feel the burning, what they have is a chronic cough. So they might not experience burning, they might not experience this acid coming up, but what it is shown up as either chronic cough or laryngitis. Sometimes they feel like asthma is getting worse, especially at night time, or disrupted sleep where they just wake up because they feel really uncomfortable at night. So these are also certain presentations of acid reflux or GERD at night time, right? So if you are experiencing these symptoms for a long time, if you are constantly having this acid reflux or heartburn, it is time to take some action. Now, one good question that Susan had asked me when I posted the link for this talk was whether low stomach acid can cause acid reflux, because we always talk about high stomach acid, we always talk about having too much of, acid being secreted, but low stomach acid, because of this acid can be lowered because of stress. The food sometimes can just sit there, and sometimes the food is not digested, and that creates a lot of fermentation, and that can lead to acid reflux as well. And usually if you're having acid reflux because of low stomach acid, then you feel better after apple cider vinegar, right? So if there's a lot of acid already and then you're adding apple cider vinegar, you're going to feel awful. So if you are not sure that, okay, am I having low stomach acid, is my stomach acid normal, am I having too much stomach acid, one simple thing to do is to take an apple cider vinegar test, right? So you can take a shot glass with apple cider vinegar, you can just drink it. If you feel like it's burning a lot, that means that you're secreting a lot of acid. If you just feel warmth and nothing more than that, then you have normal stomach acid. If you actually feel better, if you feel that, okay, I feel so much better now, I don't feel this indigestion, that means that your stomach acid is low, right? So these are some ways you can test yourself for acid reflux, whether you're secreting enough acid, whether you're not secreting enough acid, right? So let's talk about what creates what increases this risk of getting GERD or heartburn or acid reflux. I'm just using these interchangeably. GERD is actually a diagnosed condition, heartburn is a symptom, and acid reflux is kind of the process that happens, right? So what are some conditions? So obesity, right? If you are obese, that can create you to have symptoms related to GERD, right? Before a meal. Okay, I'll address the questions a little bit later on. So, so obesity is one thing where your stomach is stretched beyond your capacity. If you're overeating at the same time, that, and sometimes the excess fat in your abdomen can displace the organs as well, right? So that is why GERD, acid reflux, heartburn is very common with obesity, right? If you have a hiatal hernia, which means that if there's a loosening in the diaphragm, right, and the stomach, the top of the stomach is bulging up from this diaphragm, it's known as hiatus hernia. That can increase the risk of getting GERD as well. Pregnancy, as I mentioned before, is a physiological state where women start experiencing heartburn or GERD. Sometimes even connective tissue disorders like scleroderma can create it, and delayed stomach emptying also can cause it, right? Certain factors that aggravate acid reflux is, if you're having too much, too large of meals, if you're eating in quantities that are enormous because you love some food or something and you're eating really heavy, portions of it, or really big sizes of food, that's going to stretch your abdomen, and there are more chances of getting this reflux. If you are eating late at night, if you are eating and you just go to bed right away, what ends up happening is that your stomach is really stretched, and because you're lying down, this esophageal sphincter, like there can be a reflux from there, right? So one simple thing to do is never lie down at least 3 hours after you've eaten. That's the number one thing to do. So when it comes to acid reflux, like try to avoid sleeping completely. Like don't go to bed, sit down. If you're feeling like really lethargic, you can sit in a propped up position, where your legs are straight but you have something behind your back, so you're actually sitting and not lying down. And for certain people who really can't deal with it or are tired, after 2 hours, if you want to go to bed, sleep on the left side. In Ayurveda, this is called as Vamakukshi. So your stomach ingredients are not going to kind of regurgitate back, right? So left side, if you can lie down on your left side, not on the right side, it's just going to make the acid reflux worse. So these are a few things I wanted to talk about. um, Certain foods can also trigger acid reflux, right? We've talked about, eating too much quantity or eating heavier meals, but fatty meals, especially if your digestive capacity is lowered, fat also takes a long time to digest. So if you feel that the food is just sitting there not getting digested, that can create heartburn as well. And fatty or greasy foods are common triggers for heartburn, right? Alcohol is a common trigger, especially red wine. I know a lot of my clients are okay with white wine, but red wine constantly triggers them. Sharp spices like black pepper, cloves, garlic, raw onions, anything spicy like hot sauce, cayenne pepper, Frank's red hot sauce, sriracha. So if you're having a lot of spicy foods, it can trigger heartburn. Chocolate is another common factor. Citrus fruits. Some people are extremely sensitive, right? And citrus fruits, which are sour in taste, are going to increase your stomach acid as well. So, lemons, limes, orange juice can also trigger heartburn. Coffee, caffeinated beverages can trigger heartburn as well, including tea, right? Peppermint can also increase heartburn in some people, and tomatoes are another common trigger, right? So, if you're constantly having tomato based sauces, that could be one reason why, you're having heartburn. And tomatoes are usually acidic, like nightshades, peppers, tomatoes are usually the more of the acidic food. So that can definitely, trigger heartburn. So you just have to pay attention to it, right? Um, let's take a few questions. So Hanka is asking that how can you please explain a sour taste in the mouth when using K2FT before meal pitta prakriti. So I think you mean the CCF or the K2F. I think, so CCF is supposed to support digestion. If you're talking about coriander, cumin, fennel tea, right? And coriander is one of the soothing herbs. Fennel is something that's also soothing. And cumin is a digestive which can slightly increase the like stomach acid, but it's usually very gentle. Like cumin is not strongly increasing pitta. Now, if you are a pitta prakriti, then you might have to do some cooling measures rather than having CCFT, right? Some people are extremely sensitive, and one of my best remedies is even licorice tea, right? Make sure your blood pressure is not high, because licorice has glycyrrhizine that can, increase your blood pressure by a few numbers. But rather than the CCFT, a licorice tea, slippery elm, marshmallow, like these are soothing ones, right? That might be a better fit than the CCFT, right? So that's something you can try, Hanka, and let me know if it works for you. um, yeah, so that's a really good point, Uttamji, that if you get cough at night, you can put a small crystal of misri. In Marathi, we call it khadi sakar or rock sugar in English. And you can put it in your mouth and suck on it for a while. Now, misri or um, rock sugar is also used in one of the main Ayurvedic formulations called Sitopaladi Churna, which is a remedy for cough, right? So misri helps with cough. It also soothes any irritation in your throat. So that's what it's going to do, and that is how it works. So that's a fantastic suggestion. Thank you so much for that suggestion. That is a fantastic suggestion, right? So now we going back to triggers. Now we were talking about certain alcohol, we were talking about coffee, right? Another one most common thing that I see in my practice is people who are taking aspirin for a long time, or taking certain medications like NSAIDs, can also create acid reflux. This does not mean that you stop your medications on your own. If you are on certain medicines, please talk to your doctor. I'm just giving a disclaimer. But certain medications can also trigger heartburn, right? So be aware of that. And from an Ayurvedic perspective, again, stop having something that's very pungent, sour, or even salty to taste, right? So salt, sour, and pungent are the three tastes that actually increase your pitta, right? And if you are having a lot of acid, and the one thing to understand is, when pitta is like, if you are having that sour taste in your mouth, it's the imbalance, or what we call prakrut pitta is supposed to be like a little bit bitter. But when you're having a lot of sour taste, there are changes to your pathological changes to your pitta as well. So the pitta in your body is not balanced, right? Now, ginger for heartburn, if you're having issues related to indigestion, ginger actually helps boost your digestion. It all actually helps support your digestion, and it can help heartburn. If you feel the pungency of ginger too much, you can go for dried ginger or shunthi. So you can add a little bit of dried ginger to your water, or have a dried ginger tea, and that might be less pungent and also help you with your digestion. So, avoiding any of these foods that I was talking about, making sure your weight stays in control, making sure that you're not sleeping or you're not lying, or after eating at least for 3 hours, are some factors to really pay attention to if you're struggling with acid reflux. Now, one of the most common treatments for any kind of acid reflux is proton pump inhibitors, or PPIs, right? So PPIs, pantoprazole, rabiprazole, omeprazole, they are the common treatment. They're the first line of treatment. Now, the one thing is, they have to be taken for a maximum of 8 weeks. I know people who are on certain PPIs for the longest time. They take it for a few years, because until and unless they take, like, as long as they're taking the PPIs, they feel okay. As soon as they give up the PPIs, they're going to feel that, oh my God, I'm just feeling off, and I'm having so much indigestion, or I'm having so much acid, reflux. So the one thing is, PPIs are going to block your acid formation, which also means that you're not going to absorb a lot of nutrients if your stomach acid doesn't work too well, right? And PPIs are in the generally safe category, but long term use of PPIs can have certain adverse effects as well. It can impact with your absorption of, calcium. It can lead to fractures in the long term as well. It can impact your absorption of B12 as well as iron, and you could have lowered iron or anemia. You could also have lowered B12, which could also lead to anemia, right? There is the risk for pneumonia. There is the risk for Clostridium difficile or C. difficile diarrhea. There could be low amounts of magnesium in the body as well, right? And also, dementia is one risk factor associated with long term use of PPIs. So, if you are using proton pump inhibitors, use it for a short time. Don't think they're a lifelong solution, right? So, that's one thing to really focus on and avoid. I've already talked about the foods that trigger acid reflux. I've already talked about some of the lifestyle strategies as well. Do you have any questions? I'm going to say a quick hi to Atul. I'm going to say a quick hi to Karthik and Gutsy. Grace with grit. I think that's Shannon. So I'm going to say a quick hi to Shannon as well. And Jasmine too. Yeah, so this is a little bit on, acid reflux. So one of the things is always pay attention to your digestion, right? If you are having constant acid reflux, it's not just the acid you're dealing with, but you're also dealing with malabsorption of certain other nutrients. One simple way to understand if you're creating a lot of digestive toxicity or if you're malabsorbing any nutrients is to look at your nails. If you have any vertical ridges on your nails, if your nails are not smooth, and I don't mean like after buffering and manicure, I mean that just without any kind of nail polish on or anything, if your nails are having a lot of ridges, that means you're not absorbing nutrients. If you have any white spots, if you have any depression on your nails, if your nails chip very easily, right, it means that there could be nutrient malabsorptions or there could be nutrient deficiencies. Just in this Saturday's talk, we were talking about hair and nails being like a reflection of your bone mass, right? So if you have constant hair fall, if you are having nails that chip constantly, it also means that there is something going on with calcium not being absorbed as well, right? And if you have too much issues with calcium absorption, your bones get brittle, so do your nails and hair. Now, one other point that I didn't mention is carbonated beverages that I talked about during the bone talk that we were doing, right? So, when you are having a lot of carbonated beverages, especially with acid reflux, it's going to make things worse, right? So, I would avoid any pop or any sparkling waters or any of these if you are dealing with acid reflux. Now, what can you have with acid reflux is the question, right? So, one thing that works really well with acid reflux. Okay, just give me one quick second. Yeah. So is, any vegetables that are going to be soothing and easy, right? So even cabbage for some people can work pretty fine with acid reflux. Cruciferous vegetables, they can increase vata slightly, but they work with acid reflux or they can neutralize the acid. One of my favorite ones is known as bottle gourd or lauki or dudhi in Marathi. So bottle gourd is a vegetable. It's an extremely sattvic vegetable, and that also really supports with digestion. It also supports with acid reflux. So that's something you can start, adding to your diet. Ginger, as you know, Hanka was asking me a question that if you drink ginger tea, it will straighten your digestion. But if you're having a lot of inflammation or irritation or burning or ulcers, it might actually trigger or create more irritation. So, fruits, you can have bananas or any non citrus fruits. Now, again, bananas can go both ways. For certain people, they can trigger a heartburn. For a lot of other people, they can be extremely soothing, right? And one of my favorite grains is either oatmeal. Oatmeal can be extremely soothing. Oatmeal can help with any kind of irritation, and also rice, right? White rice or, brown rice, not brown rice too much, but white rice or basmati rice also can really help with acid reflux. Also, adding small amounts of ghee or clarified butter to your diet is going to help facilitate the healing of your stomach as well as the esophagus if that's completely irritated, right? Certain teas you can try are, slippery elm, marshmallow root, licorice, as I mentioned before. So these are soothing and healing. Also, any vegetables that are a little bit mucilaginous. If you look at okra, for example, it's really sticky on the inside. So certain vegetables like even okra can definitely help soothe an irritated stomach, right? And having good amounts of fiber, So for proper digestion, even adding lots of leafy green vegetables, methi or fenugreek leaves are slightly, increasing pitta. But if you look at other leafy green vegetables, spinach, kale, any bitter vegetables, they are going to balance your pitta and strengthen your digestion as well, right? So that's something you can definitely try. So okay, so that's another good question, Hanka. Would I recommend anyone for acidity or stomach ache related to taking medicines for rheumatoid arthritis? So I can't give you any generalized, suggestions for that. But as I mentioned, certain teas that you can start adding to your diet as long as they don't interact with your medications is slippery elm or marshmallow root. Try to follow all the diet and lifestyle factors that I mentioned. Avoid foods that are triggering. One thing that I also see with rheumatoid arthritis is people react to nightshades a lot. So if you're having tomatoes in your diet, for example, if you are having peppers in your diet, if you cut them out, it will help with that excess acidity that you're experiencing, right? So please, that is something you can definitely start taking out of your diet if you're having any of those trigger foods, right? So that's going to help with your digestion. Now, there is another good question that um, Jessica has asked. Is there a general suggestion to help increase nutrient absorption? Fantastic question. So, to help increase nutrient absorption, one of the most natural, simple ways is to add some spices to your diet, right? So, even a pinch of black pepper. So black pepper, if you're having a lot of acid reflux, it might not work for you. But for everybody else who's looking to increase nutrient absorption, when you add spices to your diet, and if you're struggling with acid reflux, cumin, coriander, fennel, small amounts of basil, rosemary, small amounts of thyme can actually help you, right? So these are all going to support your digestive fire. When you break foods down properly, that's when you can absorb them well, right? If you're looking at protein digestion, even a little bit of sour citrus can help, but not for somebody with acid reflux if it's a trigger food. Now, Bijal is asking, are green chilies okay? Not really. For acid reflux, you have to give up chilies, you have to give up pickles, you have to give up all that papadum and salty stuff that you absolutely like. So, three things to stay away, three tastes to stay away from: salty, sour, and spicy. Green chilies for inflammation, gastric inflammation, they can actually increase the gastric inflammation, right? So when people talk about cayenne pepper for circulation, again, it's not for somebody who has a lot of acid reflux. So I wouldn't do that. So Minakshi is asking, if you're getting more belching but not feeling any acid in the chest or throat, then you have to look at the vata, right? So when we look at pitta, pitta creates more of the acidity. So if there is an imbalance in the vata, or in your digestive tract, that can create a lot more of the belching. One simple thing that I tell everyone for every digestive related solution is sit and eat. Focus on your food, calm yourself down before you eat. If you are someone who's really stressed out, right, you are going to not digest food better, you're not going to absorb the nutrients. So one simple thing, and this works for belching as well, is to really take time, sit down and eat, and calm yourself down before you're eating, right? So those are a few suggestions I have to make. Again, there could be a lot of different conditions associated with chronic acid reflux. So H. pylori infections are also extremely common. Sometimes with my clients, I'll be like, okay, this is what I think you have. I can't really diagnose you, but why don't you go to your doctor and check it out? And they'll come back with having this bacterial infection called H. pylori, where they're secreting a lot of excess acid because of the bacteria in the stomach going haywire, right? So simple things go a long way. Also, drinking warm water. If you are someone who's drinking cold water, you're impacting your digestion. It's almost like putting ice on fire, right? Which is going to extinguish this digestive fire. So, warm water also helps digestion. Don't drink too much hot water if you're not comfortable with it, but warm or room temperature is the way to go. right? So I think I've answered all the questions. Hanka, if you have more questions, you can just message me. And if you are dealing with chronic acid reflux, I've had amazing results with my clients. So I've had testimonials that I've posted, people who are struggling with this for 10, 12 years, and suddenly we start working together. We make this dietary changes, we make certain lifestyle changes, we add very simple herbs, and everything shifts, right? So if you are interested, please, just ping me, message me, and I can set up a 15-minute free consultation for you. And if you think somebody else might benefit, please, share this video with them or tag them here, so then they can benefit with this information as well. So thank you all for watching this live. Happy Ram Navami to everybody that's celebrating. Happy Ram Navami, Uttamji. Um, Now it's the time for my offering, so I'm going to log off for now. In the afternoon, we have this prayer timing, so I'm going to make sure I go and get those things done. Thank you so much for watching this live. Bye for